My name is Donald Silverberg. I think probably everybody watching this knows a little bit about Nordic walking, walking with two poles. What's generally not known is that this form of exercise can greatly help people with back, hip, or knee pain. And that is the purpose of this talk. I'm an 80-year-old internist who's practiced internal medicine for 55 years in Canada, America, Sweden, and for the last 40 years in Israel. I've been involved in medical research over this period and have published over 160 scientific papers and edited 3 books on various aspects of medicine. And I'm now a professor of medicine emeritus at Tel Aviv University in Israel. I've had low back pain and stiffness continuously from age 15, which was diagnosed as lumbar disc disease, a degeneration of a disc in my lower spine. It only occurs when I stand and walk, but when I sit or lie down, it disappears within a few seconds. Indeed, when I walk, I have to stop every 200 yards to sit down for a few minutes to relieve the pain and the stiffness. And then I can go on for another 200 yards. In addition, for all these years, when I walk, I'm bent forward at an angle of about 20 degrees, and I can't straighten up. I've used a lumbar belt, I've used physiotherapy, chiropractic, Pilates, Feldenkrais, water therapy, muscle strengthening exercises, and acupuncture, and have taken many types of pain and anti-inflammatory medications, all to no avail. 3 years ago, by chance, I saw a demonstration of Nordic pole walking, or Nordic walking, in which one walks with 2 poles about waist high in length. The poles are aimed backward at an angle of about 30 degrees, and as you walk and swing your arms normally, you push down and backward on them. This projects you forward and upwards, straightening the spine and pushing you forward, thus giving you a longer and faster gait. I decided to try them out. I had nothing to lose and received a 5-minute instruction. I started to walk and waited expectantly for the usual pain and stiffness of 65 years to kick in. Nothing happened. There was no pain or stiffness on 50 yards, 200 yards, 500 yards, a mile. I was stunned, and my back was straight as an arrow. How could this be? How could this happen? When I didn't use the poles, the pain and stiffness and bent over posture came back right away. The pain and stiffness and bad posture on ordinary walking have continued to be absent on walking for 3 years, and now I can walk 3 miles with them without stopping. I was so stunned by the initial experience that I went to the medical literature in my medical library, to see what others had found about Nordic walking. In 12 medical texts on orthopedic, physiotherapy, rheumatology, or pain, not a single word was said about Nordic walking for back pain, for hip or knee pain. What about articles in the medical journals? There were only 2 articles in the whole world published, and both showed improvement in low back pain with Nordic walking. Another one showed improvement with severe osteoarthritis of the hips, and there were no articles at all published about the effect of Nordic walking on the knees. I found that, so I went into Google, and in Google I found the testaments of many people who reported an enormous improvement in pain in the shoulder, in the neck, upper, low back, ankles, knees with the Nordic walking after years of trying and failing with various forms of treatment. I began to feel I was not completely crazy, that I was not alone with these startling things, findings, but I'd found on my own body. How does Nordic walking reduce pain in these areas? Probably the main reason is that the 2 poles take some of the body weight off the spine, the hips, and the leg, because they are like 2 extra feet. For example, my weight is 85 kilos when I walk normally, but when I use the poles, it's 65 kilos. It's like I'm on the moon. There's less gravity. But what a difference that makes to the spine. The stress on the neck, the shoulder, the back, hips, knees, and ankles is much less. This produces muscle spasm and pain. In addition, I mentioned earlier that by thrusting the poles backward, your spine straightens up, improving the posture, and this also causes less spasm of these muscles, which also relieves the pain. So it's a combination. I felt I should investigate this further, So I wrote an article about my experiences in a local community journal called Ezra Magazine in Israel, and another international newspaper, and asked for volunteers who suffered from back, hip, and or knee pain to call me. 150 people called me who wanted to give Nordic walking a try. They'd had pain for an average of 11.7 years. 11.7 years. Their average age was 75. My associate, Alex Prejserowicz, a certified trainer, went to each of the homes of these people and sold them the poles for $50 and up, and instructed them. The instruction took about an hour in Nordic walking, and then I followed these people by telephone over a period of 12 weeks. Calling them at 1 week, at 6 weeks, at 12 weeks, and 91% of them continued to use the poles for the whole period of time because they felt they were getting some benefit. Only 9% said they stopped them because they weren't figuring they were getting enough benefit from them, but 99% continued on. Most of the improvement in the pain occurred during the first week, and gradually the pain seemed to be less over the next 12 weeks as well, and the improvement in walking increased also. As a matter of fact, the total improvement in pain on a scale of 10 went down by 80% in their experience, in their impression, and the distance they could walk increased from about 350%, from about 500 yards to 1,800 yards. Not a single one of the 150 people had ever received a suggestion from any health care professional to use the poles, despite suffering from an average of, as they say, 11.7 years of pain and getting many, many kinds of therapy. The result of the first 100 cases I saw were reported in the International Journal of Physical Therapy and Rehabilitation in 2016, and can be obtained and read in Google by Googling Nordic Walking and my name, Donald Silverberg. Despite the increase in distance walked, the people surprisingly did not feel that they had exerted themselves any more than they had with regular walking before Nordic walking. This failure of an increase in perceived exertion is well recognized, but it's surprising considering that Nordic walking increases your energy demands by the body by about 40%, since the muscles in the upper part of the body are greatly activated, something that does not happen with ordinary walking. The heart rate also increases. More oxygen is used up and more calories are burned. Yet this longer and faster walking does not seem to cause any more fatigue than ordinary walking. Very strange. This increase in energy utilized increased calories, you burn more calories, so that you're overweight, you tend to lose weight. In addition, your good cholesterol goes up, your bad cholesterol goes down, your blood sugar improves, and your blood pressure, if you have high blood pressure, also improves. In addition to that, many people who have a poor mood find that their depression seems to leave them when they're out there with walking either alone or with other people. A great enemy of the elderly is falling and associated fractures. The combination of increased muscle strength and 4 legs instead of 2 is associated with more stability and reduced tendency to fall with Nordic walking. The safety of Nordic walking is underlined by the fact that it's now used in the rehabilitation of people after heart attacks, and in those hospitalized with heart failure, and in those with poor circulation in their legs, chronic lung disease, and in Parkinsonism patients. Chronic pain, especially chronic back pain, is exceedingly common in our society and causes a reduced quality of life, reduced income from days lost at work, reduced function at work, depression, and increased emergency room visits and hospitalization. It's daunting to consider that in this high-tech world, something as simple, inexpensive, safe, and easily learned and pleasant to do as Nordic walking could become a major contributor to the treatment of back, hip, and knee pain. In an age where we're faced with the cost and dangers of pharmacy, too many pills, how refreshing it would be if some of these pills could be replaced by something as non-toxic as 2 walking sticks.